guys, welcome back again to my channel. If today is your first time of joining me, you're super welcome. If you are here already, you have already subscribed, God bless you for choosing to watch from this channel. You are blessed, you're blessed, you're blessed. And once again, happy new month to all of you. I've all wished you well in my previous video. So into this one, let's just dive straight to the gist, straight to the tips, straight also to what we have today for you guys. Yeah, today is 1st of December, and I know a lot of you don't know about today. A lot of you don't know about what today have been designed to be. Yes, so in case of our health, pertaining our health system, and also our status, I want to let you know that it's a good news anyway. Yes, 1st of December have mapped out as a World AIDS Day or World HIV Day. Yes, every 1st December of every year is being mapped out as World HIV or World AIDS Day. So a lot of organizations, a lot of NGOs, a lot of health centers, yes, public and health facilities have used today to share awareness, to create awareness to a lot of people about HIV. And guys, that is what I want to do here. Yes, we have done that in the field, and I want to do it here again in my channel. Please guys, I want to create awareness about this. Yes, this is what we do. What you know, you need to let people know. A lot of people don't know some certain things, and that is the reason why we keep on having issues. Awareness is the key. Awareness is the key. So bear with me that this video is coming late, but it's something that we need to know. It's something that we need to learn. It's something that we need to know and also teach our children, our family. It's good for our children also to learn. I normally tell parents that once in a while, make sure you sit your children down, tell them, speak to them, tell them what they need to learn, tell them what they need to know. Yes, if it is something that you need to carry out a routine checkup about your family, about your children, please do that. It's very, very important. It's very, very preventive to so many diseases, infections outside there. Yeah, that is it. Now today, as I said earlier, have been mapped out as World AIDS Day or HIV Day, and awareness have been carried out to teach people, to teach the young youth, the adolescents. Yes, more especially adolescents. We need to let them understand about HIV and also AIDS, how this HIV is being spread, how it's being contacted, the preventive measures, the treatment, and all about that. Now, what is HIV? HIV can be defined as human immunodeficiency virus, while AIDS can also be defined as acquired immunodeficiency syndrome. X is the advance of HIV. HIV advanced to X, and when it gets to X, that is a dangerous part of it. Yes, so I have to put it, that is the bad aspect of it. So we need to avoid HIV getting into X. That is why we go out there to create awareness to people, to let them understand that, please, there are some certain things you need to do. There's something things you have to do to make sure you live long. A lot of people think that when someone is being HIV positive, that person is prone to die early. Yes, we know. If you did not take preventive measures, if you don't do that thing you need to do that will keep you going, keep moving, it's possible that you can be able to, that is just the truth. But it's good. I have to tell you the facts here. The fact is that you have to take a preventive measures. You need to do that which you need to do to make sure your status, your health, and everything is okay. A HIV positive person can live 100 years and can live above, in fact, to the age that God have destined you to live on earth, as far as you're keeping yourself to the track where you're supposed to be, not to mislead yourself or go out of what you're supposed to do. That is it. So, aside defining what is HIV and AIDS, how does HIV get to the body? And what does it do to the body? Yes, HIV targets the blood cell. Yes, it targets the white blood cell and damage the white blood cell. What does it do again? It weakens the immune system. And when you weaken your immune system, you are prone to have every other infection, diseases that can lead to X. That is the truth. Yes, because when this particular immune system is low, when your immune system is not active again, because HIV have already damaged the white blood cell, you're prone to other diseases, for example, tuberculosis, other infections, and also cancer. That is just the basic truth. Now, I just want to take this lecture periphery. I don't want to go deep about it. I just want to create awareness, say one or two things that people need to know about HIV, and what people have been thinking that, okay, this person is HIV positive. Because it's HIV positive, discrimination have been there, and because of that discrimination have led these people to go into depression, and from depression it can lead them to something else. So I want you to understand that someone being HIV positive doesn't mean that, yes, if this person is a HIV positive in your family, it can equally be affected easily like that. No, there are some certain ways that HIV can be sprayed. And how does it be sprayed? It can be sprayed through fluid. from an infected person. From an infected person, a fluid of an infected person. For example, this fluid can be blood, it can be a breast milk, it can be a semen, and it also can be a vaginal fluid. So if you don't have access to this, you're not going to contact that. A lot of people think that shaking of hand, kissing, you can contact. Yes, let me just elaborate that side of kissing. It can be easy that way if that person has a wound, the two person have a wound, and the other person is affected. If the person is affected and the other person is not affected and you have a wound, and when having that kiss, it can equally lead to that. When the fluid of this person get to this person that also have a blister or what in the mouth, it can equally be contacted through that. So it's very, very hard through kissing. Then from handshake, HIV cannot be contacted through handshake. No, a lot of people used to fear, this person is HIV positive. No, I cannot be able to, shake hand with that person. No. They will just, that discrimination have been there. You can't contact HIV through handshake. No, you cannot contact it through food, sharing of food. This person eat food from the same plate, you use the same spoon to eat food. You cannot contact it through that. I've already mentioned that it can be from blood transmission, yes, from hard, sharp objects, and it can be. And for that sharp object, it must be an instant one immediately, because HIV doesn't last long outside. They normally go into discrimination of people that are HIV positive, and they say, no, I cannot have a handshake with you, I cannot sleep in the same bed with you, I cannot have, no, please, let's stop that. It is not necessary, it's not good. Why doing that to them? You are also pushing them into depression. They will feel they are not human being again. Before you know it, depression have entered, and when they enter into that condition of depression, which can lead them to something else. So please, let's just avoid that. Show them love, show people that are around you, if they're HIV positive, show them love, because they can equally live. And another way that one can also contact HIV is through mother and baby. Yes, through breast milk. But the chances of that is not like that again, because if the mother is under the antiretroviral therapy, there is no way that child can contact. As long as you're taking your medication properly, which is ART, that child cannot be able to contact that. That is from mother and the baby. Yes, please bear with me. This particular lecture, I just want to brush it out so that people will be able to get something. I don't want to leave it. Today is World AIDS Day, and I did not come here to share what I know and what I can share and how to encourage people. So that is it. So these things I have just mentioned now, you cannot contact HIV through food sharing, you cannot contact it through handshake, you cannot contact it through lying in the same bed with the person that is affected, you cannot contact it sharing the same clothes. No, you can't contact it this way. You can only contact it through fluid, through breast milk, through semen, and also vaginal fluid, as I've just mentioned. Then what are the prevention and the treatment? What are the prevention and the treatment? What are the prevention and the treatment? This is the key. This is very, very important. Very, very important for a HIV positive patient. This is the key. The treatment and the prevention. Then the treatment you have here is that as far as you have gone to the hospital and you have been tested that you're HIV positive, remember there's what we call a window period. That window period, you might go to test and they run the first test. It takes about 28 days. Yes, 28 days and thereabout. It might not show that you're HIV positive until you go back again for the second test. From this period, at least from 1 month to 3 months, after the window period, it can be able to dictate. So many people go to test, and when they run the first test, they say they're negative. Coming back for the second time is positive. But it's good that this test, you do not run it once. Run it in different places to confirm your status, to make sure your status, the test is accurate. And that is why it's always being advised that, so make sure you run your HIV in a well-known hospital. Yes, where your result can be very, very accurate. We know that there are some mistakes sometimes, but at least 1 or 2 or 3 places can also clear you off and make you understand that, okay, this result is accurate or not. Now, treatment I'm talking about are the treatment. There are medication for HIV positive people, and this one is very, very free for every hospital. This particular medication is free for every hospital, every government hospital. As far as you're a registered patient, the medication is free. So that is why we advise people that as far as you are on this therapy, see, the chances of you living long is there. As far as you maintain your therapy, the chances of you living long is there. What is this? This is antiretroviral therapy. Yes, we call it antiretroviral therapy. Antiretroviral therapy. That is ART. Yes, in a shorter form is ART. It's been that's a particular medication that is given to a HIV positive, and this can suppress this particular virus in the system and makes you live normal. And I want to give you this good news. Do you know that many people who are also taking their drug properly can go to tests and you see that their tests can also show undetective? Yes. Why does it show undetective? If your viral load have already been suppressed, when you take your medication properly the way you're supposed to take your medication, your viral load will definitely be suppressed. And when it's being suppressed, what else are you going to see? That you can see that that particular test can go to undetective. And when you're on undetective, that doesn't mean that HIV virus is out of your system. That doesn't mean that you are not HIV positive again. But at this period, you cannot be able to infect another person. Yes, this particular person, if your partner is not HIV positive, as far as your HIV is, have been suppressed, it's very hard for you to pass it out to another person. But that doesn't mean that you should not use protective. It's very, very important you also use protective for partners. That is the advice. And aside from that, what am I actually mixing? Yeah, the viral load. That is what I want to say. Your medication is very, very important. And most people, when they give them this medication, the problem they normally have is that they don't take their medication at the proper time. This is some mistake a lot of people make, taking their medication, taking their HIV medication, taking their antiretroviral therapy. This is a lot of mistake a lot of people make in taking their antiretroviral therapy. Yes. What are these mistakes? When this medication is given to you, you're always being advised to take your medication at a proper time. If you're taking it by 8 o'clock, make sure they're taking it by 8 o'clock. Don't miss it 8 o'clock. If you know you're taking it by 9 o'clock, make sure you take your medication by 9 o'clock and don't miss it from 9 o'clock. As far as you're taking your medication normally the way you're supposed to take it at appropriate time, I am telling you that you have the chances of living as old as you want to live, and this virus will definitely be suppressed in your system. You go to test, you see that your viral load is low. There are some people you see that the viral load is less than 20 before you know it is undetective. As soon as your viral have gone to less than 20, it can be undetective. When it's undetective, you are living good, you are living fine. So please make sure you take your therapy, make sure you take your ART properly the way you're supposed to take it. And for the young girls, for adolescent children, now let's advise our children that it's very, very important for them to take preventive measures. They are growing up, they should not be lured into what they're not supposed to do. They should keep their time, they should keep themselves safe because of this particular a virus that you don't know, because it's not written in the face. Yes, you can see somebody that have it, it's not written in the face. So that is why it's good for them to take a preventive measure. Know how to do things. Don't use sharp objects. Don't use sharp object with someone. If you go to barbing salon for the guys, make sure they sterilize whatever they're going to use to barb your hair. If you're going to pedicure or manicure, make sure they disinfect whatever they're going to use to do your pedicure and your manicure. It's very, very important that they disinfect it. Disinfecting it is very, very important. Disinfecting it is very, very important. Any barbing salon you enter, any hairdressing you enter, as far as they are using a sharp object, whatever that can be at risk to your health, make sure that they sterilize it, they disinfect it before usage. So I think this is a little tip I can be able to share here. For our young ladies, please be cautious of what you do. Yes, don't lose guide yourself. Don't lose guide yourself, because HIV is not written by face. Take a preventive measures. Go to text. Make sure you text yourself. Know your status. Know your health status is very, very important, so that you can be able to know how to treat yourself. I think I have shared a little I can be able to drop here. As I said earlier, I don't want this particular video to be that lengthy. Please take this courage, and also let us stop discriminating. Discriminating is not the key. Don't discriminate. Show them love. If you have anyone that is HIV positive, show them love. Don't discriminate from them. They are human beings like us. They can live as many years they can live on earth. They are just human beings. It's just a circumstances that leads to that. That doesn't mean they are not human being again. They are human being. Thank God for the antiviral therapy that is there. Yes, thank God for the antiviral therapy. Don't miss out with your antiviral therapy. Go to any government hospital, register there, make sure you register there. Your medication is free. You're not buying it. Yes, many government hospital give it free. So if you're going there to get it free, get the one that will take you up to 1 month to 2 months to 3 months before you go back again. You're taking your medication normally, and before you know it, you're living better and living good. So here we share the good news. HIV positive patients, they are human beings like us. They can live long. They can live to the number of years that God has created them to live on earth. Yes, they can marry. You can get married. They can get partners, and that is another thing I want to share here. Let me not leave it apart. They can be married. A HIV positive patient can marry a HIV positive patient. A HIV positive patient can also marry a non-HIV positive patient. In as much as you're taking your therapy and you're suppressed from the virus, your virus is undetective, you cannot affect the other person. But that the most important thing is make sure you take your medication. Your medication is very, very important. Take your antiretroviral therapy. Your antiretroviral therapy is very, very important for you. A lot of people mix that with the antiretroviral therapy. That is, in short form is ART. We call it ART. Make sure you take your ART. If you take your ART properly, guys, I'm telling you, your viral load will definitely be suppressed. As far as you're taking it accurately, taking it at normal time you're supposed to take it. Now, let me tell you that some people mix up medications, of course. How? Because this therapy is given to you, and you will also be advised to take it at a particular time. If you're taking your antiretroviral therapy by 8 o'clock, make sure you take it by 8 o'clock. If you're taking it by 9 o'clock, that is why you're always being asked, which time do you think that is convenient for you to take your therapy? If it is 8 o'clock, if it's 10 o'clock, if it's 9 o'clock, make sure that this particular time, as far as I am at home, if you're at work, if you're coming back, you come back at by 9 o'clock, 10 o'clock, definitely you take your medication. You don't miss it from that time. If you're taking it, you're supposed to take it. I am telling you that your viral load will definitely suppress. Your viral load will definitely be suppressed. As far as you're taking it and you're not missing it, your viral load will definitely be suppressed. And one thing again I want to share here is that a positive HIV patient can equally marry a non-positive HIV person, of course. And both of them can live and have children without contacting HIV. As far as your partner is taking his or her medication accurately and the viral load have been suppressed, you can marry a non-HIV person and have children. So the main cocoa here I am talking about is you taking your medication properly. Some people take today, tomorrow they will not take. Next tomorrow they take, the other they will not take. You see that you are missing that, and that medication will not work for you. But as far as you're taking it accurately the way you're supposed to take it, it will be effective. In fact, it will work perfectly. I've seen many people who have HIV and at the end of the day, the viral load have been suppressed. They are undetective. Yes, less than 20. You see somebody have less than 20. When you have less than 20, before you know it is going down, and before you know it, it's undetective. But that doesn't mean that you are not HIV positive. The HIV status is still there, but you cannot be able to affect another person. The chances of affecting another person is not there because the viral load have been suppressed. You have already built your antibodies. Your immune system have been built. Your immune system are now strong to fight the bacteria, to fight the virus. So it cannot be effective to affect another person. So that is why this antiretroviral therapy is very, very important. A lot of people will tell you, no, I don't want to take it, I took it. In fact, let me just also share this again. Some people will also take this medication, take their ART, and when their viral load have been suppressed and they say they are undetective, they will stop taking their medication. That doesn't mean you stop taking your medication. If your viral load have been suppressed, that doesn't mean you are not going to take your medication. You continue taking your medication. This is a lifetime medication. That is the truth. That thing you know you will take and you will live long and you live healthy. Take it. That is just the truth. I advise people, this is not that, this except God. That is the only solution again, God giving you, making a miracle, giving. So some people, when they are taking their medication and when they see that their viral load have been suppressed, they will stop taking their medication. Please don't stop taking your medication. Even if your viral load have been suppressed, you are undetective. Keep on taking your medication. If you watch at that period of time, if you stop taking your medication, you say, okay, you are free. Before you know it, you might say, okay, it might take you like, let's say 3 months, 4 months, 5 months, 1 year. You are still looking at yourself that, okay, I don't have it again. Before you know it, when it resurface again, beyond that, it will be very, very bad. So that is why we advise you, if you're taking your antiretroviral therapy, make sure you take it even when your viral load have been suppressed. Please, I'm just trying to repeat this several times because I've seen many people when they are undictative, they say they are free from HIV, they don't have HIV again, and they stop taking their medication. Don't stop taking your medication, keep on taking your medication. Yes, for you to live and for you to be safe. Preventive measures is very, very important, and that is why I am sharing this awareness here. And once again, before I say goodbye to this particular tips or update for today as World X Day, please, our adolescent children should be very careful. Advise your children, talk to your children. Families should go to routine checkup. It's very, very important. Run a test to your family members. This particular test is free in so many hospitals. That test is very free in so many hospitals. For instance, today that is World X Day. The test is free. You come out and run your test. It's very free. Yes, if you see where people are doing, carrying out their awareness, if you go there to you want to run your test, it's very, very free. And also the awareness, creating awareness, sharing these particular tips as I've just shared it now is also good for people, so that we stop discriminating and also stop those things that can help us, can make us to be, have the chances of contacting this infection or this virus. We should avoid those things. Please avoid it. Avoid anything, those things I have just mentioned here, through breast milk, through vaginal fluid, and also semen. Please, we should avoid that. Sharp objects, pedicure and manicure. If you're going there to take your pedicure and manicure, make sure they sterilize them. Make sure they have been sterilized, of course, as I said. They have been disinfected. Please make sure they are disinfected before you make use of them. Ladies that are fixing weave on, be very careful of the needles which have been used to sew your weave on, because you don't know who is sewing this weave on, if the person is affected, and we know stitch and stitch before you know it. That is the easiest ways people can contact this particular virus. So if you're taking a preventive measure for yourself, definitely you are going to be safe out there. So that is it. I think this is all I have to share here with you guys. Once again, I will say a very big thank you to all of you for choosing to watch this video. Please don't hesitate to share this video. Let it get to another person, to another person, and to another person. I decided to shorten it this way, as I said, because if I go further, it's gonna be so elaborative, and when you're watching something and you did not get good points you want to get, you'll be very boring about that. So let me just end it here for now. Once in a while, I'll also be coming to share most of these tips to you guys, and I'll say a very big thank you to all of us. God bless us, God preserve us, God protect us, and God protect our loved ones. Once again, thank you and God bless you for watching from my channel. I love you all, and bye for now.